Hi everyone, this is Dr. Patterson and welcome to week 3. This week we are going to be focused on peripheral vascular, lymphatics, head and face and regional lymphatics, HEENT, and dental. First of all, I'd like to check in and make sure you all are doing okay. We had a great time in lab last week. You all did so well practicing your assessment skills, and all the faculty, we were really impressed with your knowledge and your skills. We'll then talk a little bit about the weekly review guide and then important system assessment concepts for this week. We also don't have a case study this week because we will have our first exam in lab. So important points from week 2. We wanted to identify pertinent questions for a health history using our OLCARTS acronym. And so we talked about some different things that we would ask a person that was having a respiratory complaint, and we used our OLCART system to do that. Then we practiced and learned about performing the physical assessment of the respiratory system. You have videos that you can listen to normal and abnormal lung sounds, but most of you were able to hear normal lab sounds when you listen to your classmates in lab. And then also we want to demonstrate an effective documentation of a pulmonary assessment. So you had your respiratory documentation notes, and we actually extended the due date for those. So you would have the ability to review a demonstration of med affinity and exactly how we want you to document those notes. So the weekly guide, and this is to be completed before lab, so before your exam, is to watch this video, so we're already doing that. Review the A&P as needed. We want you to watch the multimedia lecture videos, PV and lymphatics, head, face, and regional lymphatics, HEENT, and the intro to the lymphatic system, and mark them as reviewed. You have assigned pages to read in Jarvis, chapters 21 and 14 through 17. And also, we want you to review the video and the physical assessment of the adult. It's under step-by-step viewing, and we want you to see do the head, face, and neck, eyes, ears, nose, and throat in the ATI Skills Module 2.0. And just know that we won't be using an otoscope or an ophthalmoscope in this class. We also will be having our first exam, so we want you to be able to focus on your exam, and that will be held in lab this week. For assignments this week, other than the items listed in the learning activities, there will be no assignments due this week. We want you to focus on studying for your exam, so your information from this week will not be on your first exam. Exam 1 will cover materials from the first 2 weeks. So important system assessment concepts for our new material. For subjective, we want to ask the patient if they have any or have had any edema or skin color changes, sensation loss, hair loss on legs, any enlarged nose that they noticed, if they've had a headache, maybe difficulty swallowing, if they've had any eye pain or visual disturbances or difficulties, and we need to focus on patient-centered care as well. For our objective information, we will be assessing our patients for edema, and the edema is graded from 1+ to 4+ edema, and we'll talk more about this in lab. If they have any pallor or hair loss, warmth or erythema, which means redness, any decreased sensation, and there are assessment techniques to determine this, JVD, jugular vein distension. We want to assess lymph nodes. Are they tender? Are they palpable, movable? Are they fixed? Those are all definitely things that we want to look at when you're assessing lymph nodes. We want to be able to grade our pulses. They're graded from 0 to 3+. If you can't feel a pulse, then that's when you would use a Doppler, and we'll be able to practice with Dopplers in lab. We want to look at facial symmetry and also hair distribution, perla, pupils equal, round reactive to light and accommodation, and we can check those with our pen lights. We want to make sure the trachea is midline, and we want to know how to do a thyroid assessment. And all this information is in your lectures and also the ATI videos. So exam 1, it will be held in lab this week on June 29th. We are still working on the time and location due to the COVID restrictions and the amount of people that we can have in a classroom. Ideally, we'd like to have everyone take the exam at once, but we will update you as soon as we know a time and location for your exam, and we will be announcing it by the end of the week. It will be completed via ExamSoft, so make sure you come to class with a fully charged laptop and that you have your exam downloaded and you're ready to go. And that's it. I hope you all are having a wonderful week. If you have any questions or concerns, please don't hesitate to email us. Like I said, we had a great first week, a great first lab. You all did awesome, and we can't wait to see you for your exam. Have a great week. Bye.